clinical trials, and that's important because often patients hear the word clinical trial, and clinical trial, they are not a last resort. And well, some clinical trials may be appropriate at diagnosis, at remission, or at relapse. And it's important for patients that it's always good to ask to the clinician, is a clinical trial suitable for me? Trials for patients, good to know, are carefully regulated. They are voluntary, that's important, and provide access to also innovative treatments.
I think clinical trials really are the main stay of our prospect of improving outcomes in acute myeloid leukemia. And there's a very interesting observation in patients recruited on clinical trials, whether they get the control arm or the experimental arm, they always do better than you would have predicted otherwise. Now, whether this is because of patient selection or an extra level of care, it's a very important point to flag to patients. And this applies, interestingly, across all ranges of diseases, even in rheumatoid arthritis. If you're treated on a clinical trial for rheumatoid arthritis and you get the control drug, you seem to do better. And there is something special happening there. There are a number of explanations. But I think we should be encouraging patients to view going onto a clinical trial as part of the best package of care. And there are, of course, other opportunities for patients to contribute to clinical research. There are studies increasingly using registry material where patients are encouraged to join onto a registry of patients called real-world data. And that can sometimes provide really important information about how to treat AML for future generations that are not generated through a clinical trial. There is a saying at one of the famous hospital research, clinical hospitals in London, every patient a research patient. And I think providing we think about research as giving opportunities to patients to have access to the best treatments, that's the correct philosophy.